Today we're going to talk about the face wash for clear, glowing skin that really no one is talking about. Haven't seen a single social media post, TikTok, Instagram, YouTube about this. I don't even know why myself, as a dermatologist, am late to the party and telling you guys more about this ingredient. Sure, from time to time it has popped up in my videos. I've mentioned it here and there, but it honestly deserves its own video. What in the heck am I talking about? Avar wash. Well, that's just a brand name of a prescription medicated wash, but the active ingredient in this wash is something called sodium sulfacetamide, and that's what we're going to talk about in this video. What the heck is sodium sulfacetamide? What is it good for? Does it actually help with clearing your skin and improving the overall radiance, luminosity, and giving you that glow? Sodium sulfacetamide is a topical antimicrobial. It helps to cut down on bacteria that can be problematic for our skin. For the most part, it is often prescribed alongside topical sulfur in a combined formula. So Avar wash has sodium sulfacetamide as well as sulfur. Now, sulfur is an ingredient that you probably have already heard a lot about, at least from my content, because I have several videos on it. It's something you can walk into the store and buy for yourself to use on the skin. It's anti-inflammatory and it is keratolytic, meaning it helps to break up the bonds between stubborn, dry, sticky skin cells, allowing for smoother skin, helping with preventing pore clogging. Topical sulfur is also anti-inflammatory, it is antibacterial, antifungal, and antiparasitic. But the ingredient sodium sulfacetamide is a lot more effective when combined with sulfur. So the standard combination formula is going to be 10% sodium sulfacetamide plus 5% sulfur together in one formula. Now, I've talked about Avar wash up until this point, but truthfully there are a variety of options when it comes to forms of sodium sulfacetamide plus sulfur, such as a lotion, a foam. So you may be prescribed this in other forms. Now, as I said, you can walk into a store here in the US and you can find an over-the-counter sulfur product that you can buy without a prescription. De La Cruz sulfur ointment is one of my favorites, and I have a video explaining how to use it. There's also rosacea. But you're not going to find, at least here in the US, sodium sulfacetamide plus sulfur combinations that you can buy without a prescription. They are prescription only. What exactly can it offer you in terms of skin benefit? Well, let's talk about skin conditions that seem to do well with this combination of sodium sulfacetamide plus sulfur. Number one is going to be rosacea. It is not something that by itself is necessarily going to clear the rosacea, and as you guys know from my rosacea videos, there is no cure. You have to take a multi-pronged approach, and of course be aggressive with managing lifestyle triggers. But the sodium sulfacetamide, through its anti-inflammatory properties, seems to be particularly helpful when used twice a day for rosacea, whether it be in a cleanser form or a leave-on form, such as a lotion or a foam. It may help target those little Demodex mites, which are thought to play a role in rosacea because the burden of Demodex mites is much higher in the skin lesions of rosacea compared to healthy skin. So how effective is sodium sulfacetamide and sulfur together for rosacea? Some studies suggest that it's actually more effective than topical 0.75% metronidazole gel, which if you have rosacea, there's a good chance you have been prescribed this. Now, that being said, it is often actually used together with topical metronidazole, and the combination seems to be more effective for rosacea than either topical alone. As far as effective, it can help reduce the number of those little pimple-like bumps, and to a certain extent can help with the background redness, especially provided you are taking steps to control triggers such as unprotected sun exposure, drinking alcohol, hot beverages, etc. Moving on though, it is also super helpful for acne. Of course, it's antibacterial. As I mentioned, it seems to help cut down on the burden of a bacteria called Cutibacterium acnes, which plays a key role in acne pathogenesis. In contrast to certain other topical antimicrobials, as it stands now, there does not appear to be emergence of Cutibacterium acnes bacterial resistance to sodium sulfacetamide, which is fantastic because we do not want the emergence of resistant bacteria. Bacteria that become resistant to our treatments are a deadly force to be reckoned with. When used twice a day for 12 weeks, it's been shown to lead to reduction in anywhere from 80 to 83% of the number of acne spots in patients who have inflammatory acne. As a side note, all acne is technically inflammatory, whether it be a comedone or a full-on cystic nodule. If you take a biopsy of acne, you are going to see signs of inflammation in the skin, so the anti-inflammatory properties can be super helpful for acne. Then there is seborrheic dermatitis. Now, I have lots of videos on seborrheic dermatitis If you deal with it, super frustrating. It too comes and goes, flares when you tend to get stressed out, or maybe if you get sick, oftentimes gets worse in the winter time. And it consists of these flaky, somewhat greasy patches of often red appearing skin, often localized in, say, the eyebrow area, the forehead, the sides of the nose, but honestly can appear on any body site where you grow hair. And it can get quite rubbed up, quite inflamed. And for people who have deeper skin tones, it very frequently takes away the background skin color and lightens it, albeit that is temporary. It's called post-inflammatory hypopigmentation, but it can be very distressing. It takes some time for the pigment to go back to normal once the condition is controlled, but it can be a tough situation to control for some people. So good news, sodium sulfacetamide plus the 5% sulfur can be pretty effective for seborrheic dermatitis, and it is a go-to treatment for this condition in terms of reducing flares, improving the flakiness, the scaliness, the redness, the inflammation. And if you weren't aware, seborrheic dermatitis is, related to dandruff, which happens on your scalp. It's the same condition, only this time on like your face or other body sites. And a big part of what leads to this is a little yeast that lives on everyone's skin called Malassezia. And honestly, we all have this yeast, but some people have sort of unusual inflammatory responses to it. And because sodium sulfacetamide and sulfur have anti-inflammatory and antimicrobial properties, antifungal properties from the sulfur, this combination can actually be quite helpful. And I know what you're thinking. Wait, isn't Malassezia the yeast that causes fungal acne? Yes. So if you weren't aware, there is a condition that a lot of people ask about on social media or seem to be plagued with and make content around. It is called in the public fungal acne, although that's not technically the correct term for it. It is Malassezia folliculitis. And basically that little yeast gets too comfortable in the hair follicle and there is an inflammatory response and you get these little bumps. The bumps can be very itchy. They're often like on the forehead, the chest, and they all appear more or less the same. In contrast to true acne, there are no blackheads and whiteheads, but nonetheless, topical antifungal treatments such as ketoconazole can be particularly helpful for this, but so can sodium sulfacetamide plus 5% sulfur, such as in an Avar wash, leave-on lotion, or foam. How good is it for seborrheic dermatitis? Some patients can actually be completely cleared by sodium sulfacetamide-sulfur combination alone with no other treatment. That's not the case for everyone. For example, some patients, especially who have underlying immunodeficiency, I would be willing to bet that this alone is not sufficient to control their condition, but for other people, it might be just the right ticket. Now, I mentioned rosacea. A lot of people don't realize this, but rosacea has a cousin. They are very, very similar and look pretty similar on a biopsy, but they affect the face in a different way. And the cousin is a condition called perioral dermatitis, or it can be described as periorificial dermatitis. You get these little bumps, often around the mouth, hence perioral, but honestly can occur around any orifice on the face, like around the eyes, around the nose. The bumps tend to sting, burn, have this like nuisance tingling sensation. There is often the symptoms of burning, sensitivity, similar to rosacea, but in contrast to rosacea, you're not getting the flushing and blushing, you're not getting the prominent blood vessels, you're not getting the skin thickening. For a lot of people, perioral dermatitis or periorificial dermatitis is triggered by the use of topical or inhaled corticosteroids. So for example, fluticasone nasal spray or a topical steroid cream. And it also can be triggered by using too many skincare products. The skin gets irritated and seems to respond this way. And it may also be influenced by hormones. And if you have this, it takes a lot of time for it to go away. And a lot of treatments don't end up working out too well. And we often recommend patients lay off of the skincare because that can certainly worsen it. But something that can be beneficial, likely through the same mechanisms by which it is beneficial for rosacea, is going to be sodium sulfacetamide and sulfur. A wash or a leave-on lotion, provided you tolerate it and it is not too uncomfortable for you. By itself, it can be very helpful for clearing periorificial dermatitis, but it's even better when combined with a course of oral antibiotics in the tetracycline class, such as doxycycline or minocycline, tetracycline. In many cases, this combination can completely clear the condition. So it's definitely worth asking about if this is something you're struggling with, because the perioral dermatitis struggle is real. And then last but not least, we already kind of mentioned this when we spoke about rosacea, but some people deal with facial eruptions related to Demodex mites. Again, those little mites that live on everyone's skin. For some people, they can end up causing problems. You can get these little papules, as they're called, little red bumps that are very scaly. And a lot of people get problems with it around their eyes in particular. And whether or not it's the mite itself, an inflammatory response to the mite, or if you weren't aware, it's not necessarily just the mite, but there's a bacteria that lives on the mite. And maybe it's the inflammatory response to that bacteria, because the treatments that we often use for this are anti-inflammatory and antibacterial. But because the combination of sodium sulfacetamide plus sulfur has that anti-parasitic property and the antibacterial property, the antibacterial property may be helping with the bacteria that lives on the mite. The anti-parasitic property may also be helping just cut down on the number of these mites that hold on to that bacteria. And these ingredients are also anti-inflammatory, so help calm down the inflammation. And the sulfur is keratolytic, so it can help to reduce kind of buildup of dry, flaky skin, which fuels more Demodex mites. So lots of potential reasons to explain why this topical is beneficial for demodicosis. So now that you've heard all of the ways in which this can be beneficial, what's the catch? What problems can arise with using this? Honestly, the adverse effect profile with topical sodium sulfacetamide-sulfur is actually pretty desirable. Like I said, there is no evidence that the bacteria on our skin become resistant to these ingredients, which is a plus. The biggest issue that people can run into is going to be dryness. Sometimes it can cause facial itch, redness, and it also may cause just a little bit of discomfort. And honestly, some of this, if you do experience it to the point where it's bothersome to you, might actually be modified just by changing out the vehicle. So for example, if you're using the lotion or the foam and you're having these symptoms, you might end up doing better switching to like the wash form, where you have a short contact therapy approach. That can help reduce side effects of like irritation, dryness, itch. Now, if it's used around the eyes, should it get in your eyes, it can cause irritation to the conjunctiva, so care should be exercised in that area. The downsides of this are, because it has sulfur, it does have an off-putting odor. Now, some formulations are less offensive, especially the wash form, where you don't have it on the skin for a prolonged period of time, but sulfur has kind of this aroma of eggs, which a lot of people are not so jazzed about. Now, what should you not use sodium sulfacetamide with? Like, are there any ingredients that cause problems when used with sodium sulfacetamide? Well, you want to be careful to not use it alongside benzoyl peroxide. So those of you who are, going after acne treatment or rosacea, some people do end up doing well with their rosacea with benzoyl peroxide. You want to be careful, because combining the two will produce this orange discoloration. It doesn't stain your skin, but it can get on your clothes and stain them. So it's not to say that you can't use them together, that they will inactivate, but you need to be careful, because it does produce this kind of orange, yellowish discoloration. Sodium sulfacetamide is also less effective when used alongside any sort of topical that has silver in it. Who should not use sodium sulfacetamide? Anyone who has an allergy to sulfa. Sulfa is, sulfonamides. They are a class of medications and antibacterials. People can be allergic to those. So if you're allergic, this would not be a good thing to use. As a side note, if you have a sulfa allergy, you can use topical sulfur by itself, which, as a reminder, you can buy over the counter without a prescription, and it by itself can be pretty helpful for everything we've talked about in this video: acne, rosacea, seborrheic dermatitis, perioral dermatitis. If you have a sulfa allergy, you're allergic to sulfonamides, you can use topical sulfur, but you cannot use topical sodium sulfacetamide. Back when we had the pregnancy categories, it was classified as pregnancy category C, which suggests it's not safe in pregnancy. However, we really don't have any reason to think that it is not pregnancy safe. It has been used in pregnant patients with no issue. Again, it's absorbed into the body from topical use to such a low extent that it seems highly unlikely. There have never been any case reports of adverse events to the developing baby, birth defects with the use of this. What about during breastfeeding? During breastfeeding, it's also likely very safe, again, absorbed to a super low extent, although it is cautioned to not use during breastfeeding if your infant has a condition called glucose 6-phosphate dehydrogenase deficiency, or if you have an infant who was born with high bilirubin. So 10% sodium sulfacetamide plus 5% sulfur, because that's how the prescriptions go, in my experience, tends to often be a very helpful add-on, something that can be added on to many treatments to get somewhat better results than the treatment that you were on by itself. So it's something that can either be used by itself or in combination with other standard treatments for these conditions, and is not surprising when the results are better when it's added to standard treatments than the way things were going when the standard treatment was the only thing that was being used. So I hope this video with regards to sodium sulfacetamide was informative to you guys, educational, you enjoyed it, got something out of it. If so, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow.